Hi everyone, and welcome back to Tooth Matters. I am Dr. M, and I am going to do a deep dive into a topic that's often underestimated, but incredibly important: the power of baby teeth, or as we call them, milk, primary, or deciduous teeth. Now, I know what some of you might be thinking. They're just going to fall out anyway, right? And while it's true that milk teeth are temporary, they are absolutely the foundation for your child's lifelong oral health. In this video, we're going to explore how early care shapes everything from speech development to those beautiful, confident future smiles as a grown-up. Let's start with the basics. Primary teeth are the first set of teeth to appear. Though they are formed before birth, they typically start making their grand entrance in the mouth around 6 months of age. And by about 3 years old, your little one will have a full set of 20 tiny but mighty teeth. So, what exactly do these little teeth do? More than one might think. Chewing and nutrition. They allow your child to chew food properly, which is crucial for good digestion and ensuring they get all those vital nutrients for growth. Speech development. Correctly positioned primary teeth help children learn to articulate sounds and form words clearly. Without them, speech can be impacted. Space maintainers. This is a big one. Milk teeth are like little placeholders for their permanent successors. They ensure there's enough space in the jaw for adult teeth to erupt correctly, helping prevent overcrowding and misalignment down the line. Secondly, the presence of primary teeth is conducive for the proper formation of permanent teeth, which are forming in the underlying bone. Facial structure. Believe it or not, they also support the muscles of the face and contribute to your child's overall facial shape. But beyond the physical functions, there's a huge emotional component. Baby teeth aren't just about function, they're part of your child's identity. A healthy smile helps kids feel confident when they talk, laugh, and play. It supports emotional development, social bonding, and self-expression. And when parents model gentle care, kids learn that their bodies and their smiles are worth protecting. It builds self-esteem from a very young age. Let me tell you a bit about the journey of these teeth. The emergence of milk teeth is known as teething, which, let's be honest, can be a challenging time for both kids and parents. This usually starts around 4 to 6 months of age. You might see irritability, fever, lots of drooling, and a tendency to chew on everything, even their own fingers. Typically, the lower central incisors come in first, then the upper ones, followed by lateral incisors, first molars, canines, and finally, the second molars. Around age 6, the shedding process begins, usually with those same lower central incisors. This continues until about 12 years of age, by which time most children have lost all their primary teeth and have a full set of permanent ones, other than the third molars. It's quite a transformation. The correct timing and sequence of milk tooth shedding ensures that the permanent teeth align correctly upon eruption. Fun fact: have you ever thought about what it would be like if babies were born without milk teeth and grew full-sized adult teeth right away? Imagine those tiny faces with big permanent teeth. The proportions would be all off, and they probably wouldn't look quite as adorable. Now that we have established that probably it's best that babies have primary teeth, let us focus on the common dental issues that milk teeth are susceptible to. Tooth decay. Often called early childhood caries or baby bottle tooth decay, this is usually caused by prolonged exposure to sugary drinks, especially milk. Remember, the enamel on baby teeth is thinner than on adult teeth, making them more vulnerable to cavities. Teething discomfort. As we discussed, this is normal. Teething rings, gentle gum massages, and appropriate pain relief, if recommended by your healthcare provider, can help. Injuries. Kids are active. Falls and bumps can lead to chipped or knocked out teeth. It's crucial to seek dental care promptly for any such injuries. So, how do we care for these precious little teeth? Establishing good oral hygiene habits from the very beginning is key and will prevent dental decay or caries. Regular brushing. Even before teeth appear, gently wipe your baby's gums with a soft cloth after feedings. Once that first tooth pops up, use a small, soft-bristled toothbrush with just a smear of fluoride toothpaste, about the size of a grain of rice for children under 3. For kids aged 3 and up, use a pea-sized amount. Brush twice a day. Flossing. Often, baby teeth have natural gaps, so daily flossing isn't always necessary. But once 2 adjacent teeth touch, it's time to start flossing those specific areas to remove food particles and plaque. Your dentist can show you how. Do not floss if milk teeth are loose and about to shed, as you could inadvertently end up extracting a tooth, and that too without anesthesia. An extra layer of protection can be given by 2 important preventive techniques. First is fluoride. Optimal levels of fluoride found in tap water and toothpaste provides an extra level of defense to your child's baby and adult teeth. The fluoride strengthens the surface of primary and permanent teeth by being absorbed into the outer layer of the teeth, making them stronger to resist decay. Second are pit and fissure sealants, what we call as sealants. Dental sealants are a thin coating that is painted on teeth to protect them from cavities. Sealants form an extra physical barrier between cavity-causing bacteria and your child's teeth. Studies have shown that sealants reduce the risk of decay by nearly 80% in molars. School-aged children without sealants have almost 3 times more cavities than children with sealants. Sealants are also known to arrest initial or incipient caries if properly applied. Fluorides usually provide protection more on the smooth surfaces of the teeth, while sealants protect the pits and fissures on the top eating surfaces, as the name suggests. Fluorides and sealants used in combination provide major protection against caries around the entire tooth, especially during childhood. These 2, along with regular brushing, are your child's best friends for having and maintaining good and healthy teeth. Next is the role of healthy diet. Encourage a balanced diet rich in fruits, vegetables, and dairy. Limit sugary snacks and drinks. Water is always the best choice. Dental visits. This is critical. Schedule your child's first dental visit by their first birthday. These early visits help us monitor development and catch potential issues early. Plus, it gets your child comfortable with the dental office environment. Let's unpack some specific habits. Avoid prolonged bottle use. Never let your child fall asleep with a bottle of milk or juice. Those sugary liquids sitting on their teeth for extended periods are a prime cause of decay, especially in the upper front teeth. Encourage drinking from a cup by age 1. If they need a bottle at night, fill it with plain water. Pacifier use and finger sucking. It's common for children to use pacifiers or suck their thumbs. However, prolonged sucking can actually change the position of their teeth, affecting chewing and speech. The American Academy of Pediatric Dentistry recommends stopping finger sucking by age 3. Beyond this age, bony changes can also occur, and these can be permanent. If these habits persist, your dentist can suggest ways to help, like a bitter-tasting varnish or a mouth appliance. Breastfeeding. Breast milk itself doesn't promote decay, but if breastfed babies fall asleep with unswallowed milk in their mouths, they can be vulnerable, especially if other sugary foods have been introduced. After breastfeeding, it's a good idea to gently clean your baby's mouth with a wet washcloth. The bottom line? Even though your child will eventually lose their baby teeth, they should be cared for as if they were permanent. Maintaining baby teeth largely falls on us, the adults who care for them. Simply keeping your own teeth healthy and brushing regularly sets a fantastic example for your child. By preventing dental decay and forming good oral hygiene habits together, you're not just caring for their baby teeth, you're helping them keep their smiles for a lifetime. So yes, baby teeth matter. They're tiny, but mighty. With just a few simple habits, you can help shape your child's future smile and give them the confidence to shine. Thanks for joining us on Tooth Matters, where every tooth counts, whether it is permanent or primary. If this video helped you feel more empowered as a parent, give it a like, share it with a friend, and subscribe for more pearls of dental wisdom. We'll see you next time.